So now that leads into the next one. If tests are normal, there is nothing wrong.
False, false, false.
Love it. Love it. Yeah, that is false. And it doesn't just apply to pelvic inflammatory disease. You can still have normal ultrasounds, MRIs, and other imaging with the treatable condition. And there are conditions that require a biopsy for diagnosis, such as like endometriosis. So why do these things get missed? So
This is my favorite part because I feel like it's so much like when it comes to women's health and women advocating for their health, they always feel like have to like, or they, depending on the provider, obviously, like a good provider will listen to you. But I think that there is a lot of skepticism when it comes to women and their pain and why these things get misdiagnosed. So,
of course, gotta watch more Grays. Yes and no. Yes and no. Um, so why do these things get missed? So specifically endometriosis. Why do we underdiagnose endometriosis? And it's because it doesn't show up on imaging. And I'm here to say it doesn't show up on blood work. It doesn't show up on any, you can't diagnose endometriosis on blood work, on imaging. So you can have every test available and still not be diagnosed. Like nothing's going to show up positive. The way we diagnose it is by actually looking at that pelvis. And you know, obviously we're not going to drop a scope in every patient. I think that this is kind of where the balance of medicine plays in, where it's an art. So it's a balance of me intaking the information from my patient and listening to her history, to her story, her complaints. And then from there, treating with an option that could help her. And I know that maybe not everybody likes that answer. And I'll go into like some of the things that we recommend. But certainly, we kind of treat, and if the patient improves with the treatment that we're recommending, then it kind of tells us, okay, this is working versus jumping into surgery right away. Adenomyosis, why does that get missed? And again, it's similar to this again. It can be subtle or it can miss on ultrasound. Even MRIs sometimes may not show it. Surgery is less we don't do surgery to diagnose adenomyosis. So it's very much still, again, listening to our patients and doing treatment plans that we're kind of like we're putting them on a treatment plan to see if they improve. And if they improve, that kind of confirms what we suspect. Chronic PID, why does that get missed? And, as we mentioned earlier, you may not have symptoms that you have an infection. So you know, it could certainly still be affecting you. PCOS, you don't need cis to have it. It's based on symptoms, some hormone levels, and pattern recognition. So another statement, it's a bad thing if I don't have a period.
I'm in the camp of damned if you do, damned if you don't. You know, I kind of feel that about it. Anybody else's thoughts? Yeah, I think true.
Alrighty. So this is true. So good job, you guys. But it's also false. And I'll dig into that.
Trick question.
So it's true, which I think you guys are on this a lot. So yes, not having a period is a bad thing. And we've already talked about that, right? Naturally, you should be having a period every month. Um, if you're not, it could certainly be a sign that you have thyroid problems, PCOS. Maybe you don't have enough body weight. And sometimes that just means you don't have enough fat cells that kind of help with those hormonal levels that we see in our normal menstrual cycles. Maybe you're overexercising. Maybe you're having early menopause or ovarian insufficiency, which means your ovaries aren't working properly. So you guys are right. Not having a period should definitely kind of signal you to seek evaluation from a healthcare provider. However, this is false in the setting that your healthcare provider, your lovely Lorena Madera, GYNPA, suppress your period. So this happens with birth control. And I think that this is something that um, I have actually seen predominantly in the Hispanic community that a lot of Latinas think that it's not okay for them to not have periods, even if we're suppressing it with birth control. So it is safe and it's beneficial to not bleed when you're having birth control pills continuously. So, you guys, I'm sure if you've had birth control pills, there's usually 3 weeks where you take your hormone pills, and then there's that fourth week where you're off of hormones. It's like a placebo pill. Um, so it's okay for you to skip that week and just continue birth control. IUDs, such as like the Mirena or Kylena, if you guys have seen them, they're the little T-shaped guys that go inside of the uterus. Um, and they provide hormones. And then there's also hormonal injections or implants like Depo-Provera, or if you guys have ever heard of Nexplanon, which is a bar that goes inside of your arm. Um, but these are hormones that actually suppress ovulation, which is why they are successful in contraception because they're allowing for you to not get pregnant. Um, so that endometrial lining is actually too thin to support a pregnancy. So there's no buildup, so there's no harm. Um, in comparison to if you were naturally not having periods and not shedding that lining every month. So the bottom line is if your period stops naturally, you should check in with a provider. And if it's stopped because of hormones, that's totally safe and actually helpful for any condition, that it's applicable to.
Great to know. That is, in my mind, it's like we're supposed to, which we are, but not if my doctor helps me not have
The next statement is birth control. Birth control cures chronic pelvic pain. What do you guys think? It depends. You guys are right. I've made you guys so skeptical.
it.
Yes. So actually, Ellie is like hit it right on the head. False. It doesn't cure it, but it can treat the symptoms. So, what can birth control do? So, it can reduce bleeding and cramping. It again suppresses ovulation, like what I mentioned earlier. So, this is why it is a treatment for endometriosis because those cells that are outside of the uterus are also thin and no longer producing that monthly menstrual inflammatory process. It can also help with cysts, which I didn't dive into too much on this talk. It can also manage hormonal symptoms of PCOS and then help fibroid or adenomyosis growth. It like slows it down. Um, what it does not. So, birth control does not remove scar tissue or adhesions. It doesn't treat infections and it doesn't fix underlying inflammation or mechanical issues. So, things that are already present. Um, and it doesn't work for everyone, right? Side effects matter. And that's a whole nother talk in itself. But, I think that that is something important if you've been on birth control and it doesn't help you to talk about all of the options with your healthcare provider and find the thing that works for you, whether that's the pill or maybe an implant, if that's something that you're interested in. So, bottom line is birth control can be a helpful tool, but it is not the whole toolbox, which leads me into the next slide of medical treatments and approaches to all of these conditions that we've talked about today. So, PCOS, normally, first line therapy for us is combined oral contraceptives, so a pill. And anti-androgen medication, which brings down your hormone levels, that are like testosterone levels, spironolactone. We also do use insulin sensitizers, which means that it helps you process that insulin that um, PCOS might be resistant to. So we usually use medications like metformin um, to improve your metabolism, improve the way that your body is responding to insulin. And I've actually, we do treat patients with metformin when they're trying to get pregnant with PCOS. It actually helps regulate their cycles. Weight
So
management.
you can get pregnant even having PCOS.
Yeah. Which
Uh,
that is also, I know, I kind of, I thought about adding that one into this presentation, but yeah, you can get pregnant with PCOS, but it's like you can get pregnant with PCOS, but it's something that does complicate pregnancy. But there are ways that we can help you regulate your hormones. Obviously, birth control is not an option for a woman that wants to get pregnant, but things like metformin, even lifestyle changes, like exercise, can all regulate your hormones and help with the ovulation process. Pain management, we usually use nonsteroidal inflammatories, anti-inflammatory drugs like ibuprofen, for any symptoms that patients might experience. Endometriosis and adeno, we do, again, hormonal therapies, so pills, progesterones, GnRH agonists, which is a fancy term. All of this is just medication, and yes, external hormones. I know this is a little, like, a shout out right here. Hormones aren't necessarily always bad. I think that there is a very big misconception about hormonal therapy, but these hormones are not um, they're not really changing the way that your hormones are. They just suppress. So it's like we kind of put you in a state of like not ovulating, which sounds scary, but during that time, that's what helps with like not getting pregnant. Also helps with that inflammatory process that you're experiencing every month. So, overall theme of these treatments you'll see is very like anti-inflammation, so pain relief, again, ibuprofen for cramping and inflammation. Hormonal IUDs are also a really good treatment for endometriosis. And this is a more localized hormonal therapy. So if you don't want systemic hormones that affect, that are the ones that usually produce the most side effects, like weight gain or fatigue, bloating, things like that. Hormonal IUDs are an excellent option because it's just localized to the uterus. Um, then minimally invasive surgery. So sometimes we will do surgery if, you know, the endometriosis is so extensive, like I had said, someone with like endometriosis in their belly button. We have done surgery on patients like that to remove all of that abnormal tissue and to give them a chance to, have better pain management. Another thing is, so for uterine fibroids, hormonal control, again, it can help slow down the growth of fibroids. We sometimes give tranexamic acid, which is a medication that helps with bleeding. And then there are also things like uterine artery embolization, which is when we block off the artery or the vascularity that's going into the uterus, so the blood supply, so that you don't have as heavy bleeding. Um, Pelvic inflammatory disease, we are going to treat with antibiotics. And then in severe cases, you can even, I have had patients that get hospitalized to get like IV antibiotics if they have abscesses that have now grown, internally. Big thing from pelvic inflammatory disease is if you are diagnosed with a sexually transmitted infection, then get your partner treated as well, because you can certainly continue to have a reinfection. And then follow up is important in pelvic inflammatory disease. making sure that, we ensure that you have resolution of this infection, of this issue, and then preventing any long-term complications. So, complementary and natural approaches to these conditions. I think a lot of times I have had patients who maybe are skeptical of the medical approach. And I'm here to say that medicine is a balance. It's like an art. So take what works for you, and it should be a conversation with your provider. If you want to lean more holistic, just talk to your provider about it. There are providers that are open to these other alternative methods, but I do think that it has to be like a wholesome combination of the two. So, for example, focusing on this like anti-inflammation, so your diet with PCOS would be like low sugars, anti-inflammatory. So things like avoiding caffeine, avoiding reduce red meat, supplements. They're not like fully studied, but there is some data to say that inositol, omega 3s, and spearmint tea can help like drop those testosterone levels. Exercise, any regular movement is going to help that insulin sensitivity as well. With endometriosis and adenomyosis, an anti-inflammatory diet, so reduce your red meat intake, processed foods, caffeine. Acupuncture has also been found to help some pain relief and hormone regulation. Um, I've had patients who use castor oil packs that might help support pelvic circulation, and then vitamin D, which reduces some of those like pro-inflammatory um, cytokines. Um, Uterine fibroids, we sometimes, so I was looking up some of this stuff, and green tea extract can help. I believe it's like it reduces, it can help like reduce the growth. And then there's also detox support. So your liver processes estrogen, and it things like broccoli or spinach, all of those things can help that metabolism of the estrogen. So the lower your estrogen levels are, the less like promotion there is for fibroid growth. Obviously, stress reduction, such as meditation, breath work, and then yoga is really big because it really helps with that pelvic muscle. Your pelvic muscles, it helps, stretch them. It helps with pelvic support, so it can certainly help as well. And then in pelvic inflammatory disease, probiotics, vitamin D, zinc, pelvic floor therapy, I think is something that could be used in any of these conditions, but it addresses that muscle tension. Not, and this specifically mentions post-infection, but I think that there's not enough people who know about like pelvic floor physical therapy. So that's always an option for patients with chronic pelvic pain. And then anti-inflammatory lifestyle is, in all of these, specifically in PID, would be due to reduce any scar tissue. The next statement is pregnancy will cure your chronic pelvic pain.
I don't know though. I don't feel like pregnancy cures anything. Uh, as a former pregnant person. So I'm gonna go with false.
Alrighty. So yes, it is very false. So while I see that Ellie, dang it,
Dang it.
So, I mean, this is something that people say all the time. Like, oh, just get pregnant, it'll cure your endometriosis. Oh, get pregnant, it'll help your pain. Which it's kind of like I'll go into that more. It might provide a temporary relief of your systems, but it's not a cure. And to kind of tag along, you said that Ellie said they always say it resets your system. And I think that comes from the fact that, you have a change in your hormone levels, but those hormones, ironically, are working in a similar fashion to birth control. And I know that sounds like super like contradicting right now. But if you think about it, when you're pregnant, you do not ovulate, right? Because your body already knows that you're pregnant. So you're
Mhm.
not going through like a normal menstrual cycle, it's suppressing ovulation. So it's functioning in a similar manner than like birth control, where you're no longer ovulating. So it can provide a temporary relief of systems, but it's not a treatment or a cure.
Fascinating. I mean, yeah, the not having a menstrual cycle was a perk, but the rest of it was just so much in the opposite direction.
Yeah. So, yeah. So again, kind of what I said, it increased progesterone and relaxin can relax the smooth muscle, and it reduces uterine contractions, which can temporarily ease pain in conditions like adeno, where there's this like recurrence monthly of inflammation. For Like I said, you have menstrual cycle pauses. So, no menstruation means no cyclical bleeding, which triggers pain from pain from adeno, even pain from your fibroids. And immune modulation, which, your pregnancy suppresses parts of the immune system to protect the fetus. So, your immune system dampening is going to reduce inflammation and pain in conditions such as the ones that we just mentioned. So again, this is not a cure. Postpartum pain will often return, and sometimes it can be worse because now you've had pelvic floor trauma. Maybe you have scarring from a C-section or even a vaginal delivery. And hormonal shifts during breastfeeding can sometimes also add. When you breastfeed, you release oxytocin, which is a hormone that makes your uterus contract. So that can also affect your pain.
Which
Preg-
is the craziest sensation, by the way. Like it's so weird, but it does actually happen. I remember hearing it and I was like, what does that mean? And I was like, yes, I actually do feel that happening.
Yeah.
Wild. It's wild what the body does, but it's fascinating.
And then pregnancy can worsen your symptoms at times. Maybe if you have increased pelvic pressure from now your uterus is bigger, and if you had big fibroids, as you can imagine, like we had seen, everything is, it's small space. So uterus grows. If you have a fibroid, starts to like, cause maybe issues with bowels, maybe issues with urination. Maybe you start to have back and joint pain. So the relaxin, what we're talking about is these hormones that like they relax all the like ligaments and the muscles because if your body's preparing, to make a baby. And during that, sometimes it can actually cause you to have more pain. So if you hear about like round ligament pain in patients, things like that. Um, and then hormonal fluctuations that, might actually trigger issues with patients with PCOS and endo. Another statement. Um, so it's my fault I lost my pregnancy.
I'm gonna go with 100% false, 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 false. Like big Kanye letters, false. A horrible lie. Agreed. Horrible lie.
So yes, very
All of all.
false, very um, so it is not your fault. And we'll touch a little bit on like sex, exercise, stress, contraception, and abortions. So, the majority of miscarriages, especially in the first trimester, the most common cause of a miscarriage is chromosomal abnormalities. So, from the time that that embryo was formed, it was already abnormal. There were already issues there that triggered your body to know it was an abnormal pregnancy and it wouldn't be sustainable. So that is your body's natural mechanism of getting rid of that abnormal pregnancy. About 1 in 6 couples worldwide experience infertility, and in up to 50% of infertile couples, there is a male factor involved. So this is not a female issue. This is 50-50 here. Um,
Glad we have it on like written on paper here for us to see. It makes it I mean we know it, but or maybe people don't know it, but like I like seeing that in black and white, essentially. Like they have fault too.
Yes. So certainly it can either be like, alone or a combination with the female factors. Um, and it is not your fault. It's not related to your stress levels. It's not related to you heavy lifting. It's not related to sex. That is a very common thing I hear patients sometimes. I had sex and then I started bleeding. Am I at fault for this? Did I do something wrong? And no, sex shouldn't impact your pregnancy. And just a little like shout out there to ACOG, which is the American College of Obstetrics and Gynecology. We actually do recommend 30 minutes of light exercise a day in pregnancy. Just goes to show that none of these other factors are the causes. So, common infertility causes: ovulation disorders like PCOS, fallopian tube damage from endometriosis or an infection, uterine cervical tissues, uterine or cervical issues. So fibroids creating a abnormal cavity, cervical issues being your cervix maybe dilates too early in pregnancy, maybe from it can be from procedures you've had on your cervix, age-related egg decline. So as we age, our ovarian reserve continues to lower. And then premature ovarian insufficiency, which would be your ovaries are just, they don't function normally. Again, 50-50 here. These are male infertility causes. So low sperm count or poor sperm mobility. Um, Varicocele, which is an enlarged vein in the scrotum that might actually like block the passageway of the sperm. Hormonal imbalances, any genetic issues, and any past infections, trauma, or even exposure to toxins such as like heat, radiation, or alcohol. All right. Our next statement, I cannot get pregnant because I used birth control at some point in my life.
I like actually believe this for a time. I thought that this was true.
All right. So this is false. Birth control temporarily suppresses ovulation, but it does not cause permanent suppression. So just to dig into that some here. So just a brief overview of how birth control works. So, hormonal birth control, like the pill, the patch, the ring, IUD, or the shot, it prevents ovulation or alters the uterine environment. So, altering the uterine environment, specifically in the sense of the endometrial lining, right? That's no longer nice and thick and juicy for implantation. But this is something that happens on a monthly basis. So, us, suppressing that doesn't mean that you won't ever be able to ovulate again. Once you discontinue the birth control, depending, the shot does suppress for about, you can have like suppression for 6 months after you get it. But any of these other things, the minute you discontinue your birth control pill, the minute you discontinue a patch, a ring, or an IUD, usually, fertility resumes pretty soon, if not immediately. Your body usually resumes its natural cycle within weeks or months. But I'm here to tell you that I mean, I've had patients who get pregnant like the weekend they took their IUD out. So also
Yeah.
something to be mindful of. Um, sorry guys. Um, And then again, so, temporary delay in ovulation, birth control can mask those issues that were already present because these are ways that we manage these underlying conditions. And then some birth controls can protect from future fertility problems. So any, ovarian cysts, fibroids, endometriosis, sometimes birth control can help with that. And then just a little shout out to untreated sexually transmitted infections. Birth control doesn't protect you from getting gonorrhea or chlamydia. So if you're gonna be, living your best life, just a little shout out to condom use for the moment while
Hmm.
you're having multiple partners. Um, and then here is the truth about abortion, which I just wanted to briefly mention. Um, Safe legal abortions do not cause infertility. So vast majority of people who have abortions can go on and have healthy pregnancies later. There's no evidence that taking a pill for an abortion or even having a surgical procedure where we remove the pregnancy from your uterus causes infertility. Infertility returns sorry, not infertility. Fertility resumes shortly after you have an abortion procedure. And abortions do not damage the uterus and do not damage your ovaries when they're performed safely. What can affect your fertility is untreated infections, like we've talked about today, unsafe abortions performed in non clinical settings or without proper care, and multiple uterine procedures. This is rare, but if you have had like multiple, what we call like dilation and curatages, or even, yeah, so that is, if you have multiple of those procedures, if you scrape the lining too much, it can cause like scarring, but this is very rare and we don't see it after just like one or two procedures. This would have to be like multiple. Alrighty. Our next statement is I should try for a year before seeking fertility treatment or evaluation even.
I mean, a year just seems like a long time. So I'm gonna say false. I think false. Another false, another false. I think the consensus is this is false.
So again, it depends.
Oh wow.
We'll go, we'll talk about this some more. So, if you're under 35, we do usually recommend that you wait for 12 months before seeking ovulation. Ages between 35 and 39, we say wait 6 months because there's a lot of factors that go into fertility, right? So, not to say that you're going to get pregnant the first time you try, but we do recommend that you try it's more so coming from like we don't want you to be discouraged and think that you have a problem if you're unable to get pregnant after a month or two of trying. Um if you are over 40, this you should seek evaluation right away. And that's really just because that ovarian reserve is dropping and we want to make sure that you get evaluated the sooner the better. However, this is where it kind of, disclaimer, regardless of age, if you are not having normal periods, right? Or if you've been diagnosed with PCOS, endofibroids, if you have a history of sexually transmitted infections, a history of abnormal pregnancies, which would include miscarriages, ectopic pregnancies, anything like that, then I would seek medical care before trying for 12 months. When we say try for 12 months, that those are women that have, periods every month. So they know they're ovulating. Um that last portion says anovulation while trying, and there are women who will like test their like luteinizing hormone. Those are the ovulatory prediction kits, if you guys have ever heard of them. Those strips that like, you like pee on when you're like trying to track your cycle. So if you're checking that during your ovulatory days, which would be like day 11 through, again 15, and you're not seeing that LH spike, then that can mean you're not ovulating. And so I would um seek treatment at that point, and evaluation. Really, it's evaluation. Treatment isn't the right word.
That is crazy. I would have not thought that like 1 year. And I guess I wish that was more known because it would help people like not feel so terrible when they are trying. Like,
Yeah.
it makes them feel like a failure and in instances where like that's what they want. Well, man, love these myth busting. It makes puts everything so much more into perspective.
Yeah. I know I think that's why it's just important to have these conversations. So we can, talk about there's so much like misinformation out there. So and I'll get into any questions you guys have in just a moment. I promise I'm almost done. Thank you for staying with me. This is the next one. I cannot get pregnant during my period. What do we think, you guys? You can certainly still get pregnant. Um, Another fact here is, yeah, so yeah, if you have short cycles, you can actually ovulate sooner. So if that sperm is like chilling in there, making a home in your uterus, and that little follicle gets sucked up by those finger-like projections, then there you go.
Crazy.
Um, were you gonna say something, Ellie?
Oh, I'm so sorry. You kicked me out, so I'm back.
Oh, sorry, I just saw that you weren't muted, so I was like, oh, Ellie's gonna say.
Oh, sorry.
No, 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 it's okay. Um, so yeah, so that kind of ties up the last like myth that we busted today. I have a couple of slides that just are more like questions leading into our Q&A. So when should you see a gynecologist? I don't know how applicable this is for our audience since I don't know you guys personally, but if you guys have teenage girls, then I would recommend, I mean, it is not like a straight cutoff, but I do think it's important that once they start having their menstrual cycles, they not when they're have their menstrual cycles, but if there's anything unusual that you guys see, if they're missing periods, if they're really painful, those would all be signs to take them to a gynecologist. I was reading like actual recommendations because I personally don't think that there's a cutoff. I think it's like if you're questioning that anything is abnormal, if you have a question that something's wrong with, you know, your menses, with your pain, you should see a healthcare provider to see if there are any answers that you can get for your questions. However, on that note, from age 13 to 15, they should be having their menstrual cycles. So it probably is beneficial for them to have their first visit during that time. And really, it can just be general health, establishing care with a gynecologist, talking about things like we did today, right? Them learning about their anatomy and what that means and what's normal, what's not normal. It can also be a little introduction if they are going to be sexually active to maybe talk about birth control options for them, and practicing safe sex. age 18 or when sexually active. So leading into that, if they haven't visited by age 18, it's a good idea to see a gynecologist as they're becoming sexually active. We'll talk about birth control then, STI prevention, menstrual health, and reproductive health. And then they'll start having their regular exams. We typically don't do like pelvic exams unless there's like a reason to until after age 21 when we do start recommending yearly pap, not yearly, sorry, when we do start recommending routine pap smears. How often you get a pap smear is also that's more so just based off of your sexual history and if you ever have an abnormal pap smear. Here is again what I mentioned earlier. They should see someone if they have severe menstrual issues, pelvic pain, or pain during intercourse, abnormal discharge or bleeding, and concerns about sexual health or development. Another slide here, just kind of tying in, green flags in a medical provider that you may see. So, someone who does active listening, someone who's actively listening to your concerns. They want to know your story, they want to know all of your symptoms. And they're taking the time and creating a safe space for you to say all of those things to them. Someone who's compassionate and empathetic. So, they will be empathizing with you on these sensitive, very intimate topics that we have to deal with, right? And they create that safe space for you. Clear communication, someone who will sit down and explain to you and, in non-medical terms, what's going on, underlying processes, and they encourage you to ask questions and feel comfortable and empowered about knowing what's going on with your body. And someone who has a collaborative approach, which means that they listen to what you want for your treatment plan and they make this a two-way conversation. I always tell my patients, ultimately, you're in charge of your health. So if you do not want something that I'm recommending, you can always say no. But this is an active conversation between us, and it's a balance of me finding the best treatment that's personalized to your needs. Other green flags in a medical provider are someone who, is going to respect your boundaries and respect when you may be uncomfortable. Someone who's going to make you feel comfortable while they're doing a pelvic exam that can be very invasive. Someone who encourages preventative care. So, someone who will take the time to talk to you about why your pap smear is important, why your breast exams are important, why it's important for you to have STI screening. Also, lastly, this is obviously these are things that you don't really get to vet until you meet the provider, right? It's the interaction that you have with them. But I think outside of that, looking at their reviews and their reputation. So, someone who has positive reviews and feedback from patients and maintains a good reputation in the community, and they have a history of, professional and respectful care. So, with all that being said, I apologize this was so long, but I hope you guys were able to learn stuff, something new today.